Está empezando el show del Dr. Roy Aranda, donde abordaremos temas sobre separación niños de padres, casos de violencia, traumas con los indocumentados, cómo resistir ante tiempos de pandemias. Llámanos en vivo al 1-888-900-2811, extensión 6, y haz tus propias preguntas al aire. ¡Comenzamos!
Good evening, my dear Tribuna TV viewers. Buenas noches, queridos televidentes de la siempre famosísima Tribuna TV. Today is July 1, o es Julio 1. Wow, qué rápido que se pasa el año. How quick this year is going. Already July 1. So here we are. I'm broadcasting thanks to my producer, Oscar. Oscar, por favor, saluda a todos.
Hello, how are you?
See, I told Oscar to try to say it in English, which he did. Thank you, Oscar. We have a, you know, what I hope, as usual, will be an informative and interesting show for the viewers. And interestingly, in this particular show, in este show in particular, we're going to be focusing to a large extent on adversities, and we're going to be talking about how disabled people deal with different kinds of adversities that they have in their lives in different settings, you know, con problemas que tiene la gente con dificultades motóricas, intelectuales, cosas así. But, you know, the adversity is something we all face. You know, we all deal, whether we're able-bodied, whether we have some form of a disability or not. We encounter adversities every single day. And interestingly, no exception tonight. I think I've told the viewers before that we've had problems with the weather and that, you know, electricity's gone out, and there have been times I've heard thundering in the background. So we actually did have a power outage, which is why it was starting a little bit late today. And Oscar had to pretty much reboot and restart. And he was kind enough to call me while I was at home, concerned about my coming to the studio. It was pouring and thundering. So I said to him, well, I'm going to really venture to go out. There are things we can't control. Obviously, I can't control the rain, but I can control whether I bring an umbrella. You know, I can control whether I choose to drive and it's pouring. I can certainly choose to drive depending on weather conditions and road conditions. That's pretty much up to me. So I did come with my trusty large umbrella, and I brought a cane just to make sure that I didn't fall on the sidewalk. And, you know, cane is certainly one of the things that this particular show, I'm sure that many of our viewers will be able to relate to. So that said, I did want to share with you that we have a wonderful, wonderful guest. And the topic of the show today is the impact of COVID-19 on people with disabilities. Okay, el impacto de COVID-19 con gente que tienen dificultades de diferentes formas de deshabilidades. So my guest for today, and I'll introduce her momentarily, is Dr. Sharon McLennan-Weir. She is an expert in this field, and I could not have picked a better person for this particular topic. I have expertise in this. I mean, considering my own mobility problems, my wife's issues, many of my patients who've had difficulties stemming from occupational injuries. I've certainly been around the block many times dealing with people with disabilities. But I have not worked in the field the way she has, and she's really a star in this area, and I'm delighted to have her. Let me indicate that the show is being recorded on YouTube, and tomorrow a recording will be available on several electronic platforms, YouTube, Tribuna TV's own website, FaceTime, Vimeo, and likely other electronic platforms for you to take a look at or rewind and see if there's particular areas of the show you want to focus on more. I encourage viewers who are interested. We have several slides today. This is a very big topic area with many different issues that we're going to explore. And I wanted to make sure that we had several slides. So we have more slides than usual. And I do encourage the viewers who wish to take photos of the slides or wait for the recording and they can take screenshots. I will be putting up the slides, each one briefly, talk about it, and then I'll ask Oscar to put the slide down, and Dr. Sharon and I will engage in a conversation covering the main issues of each slide. So, Oscar, por favor, the primer slide. We're going to look at slide number 1 as usual, introduction and dedication. So, approximately 61 million people in the United States have a defined disability. Now, this is from the Center for Disease Control. And groups at high risk, we have focused on this on other shows, but I think it's neatly summarized here. People with mental health issues, people with underlying chronic medical conditions, people experiencing homelessness, people with developmental and or intellectual disabilities, older adults and those in long-term care facilities, refugee populations, people with limited English proficiency, and people living in prisons and jails. So, people with disabilities and developmental and behavioral disorders are highly stigmatized. They're already stigmatized prior to the pandemic. They encounter many hardships, obstacles, and challenges exacerbated by COVID-19. Some examples: increased economic inequity, discrimination in accessing health care, transportation, effective communication, in addition to academic learning environments, school environments, vocational environments, and work inequities, unnecessary institutionalization, and a lack of accessible housing options. In this show with my guest, Dr. Sharon McLennan-Weir, we will focus on the impact of COVID-19 on people with disabilities and efforts to rectify these terrible wrongs that they encounter and live with. The show is dedicated to all viewers who have experienced untoward hardships, obstacles, and challenges because of their disability. And a personal note from me, as far as I'm concerned, you bring beauty to the world. Your diversity and whatever it is that you have is beautiful. So I just wanted to put that out there for you all. Puede sacarlo. Slide 2 is an introduction to our guest, Dr. Sharon Melise McLennan-Weir. She's been working in the field of rehabilitation. I'm going to abbreviate this a little bit, Sharon, for the sake of time, but it's put up on slide 2, Oscar. It's up on slide 2, so feel free to take a longer look. She has been working in the field of rehabilitation, counseling, and mental health for over 20 years. She received her PhD degree from Seton Hall University in counseling psychology in 2012. I don't think I ever told you. I taught a course there. I think once or twice I taught as an adjunct. I had the pleasure of going to Seton a couple of times. That's a long time ago, very long time ago. She obtained a United States Law and Methodology Certificate from New York University's School of Continuing Education in 2003, her MS degree in Rehabilitation Counseling at Hunter College, CUNY, in 1998, and a Bachelor of Science degree in Biology from Syracuse University in 1993. She's a certified rehabilitation counselor and a New York State licensed mental health counselor. Currently, she works for Berkeley College as the Director of Disability Services for New Jersey and New York campuses. Sharon, when we put the slide down, feel free to talk about the change starting next week. She's launching the next stage of her career and really moving into a very distinguished position, just starting next week, right after the July 4th holiday. So she's dedicated to providing training and presentations regarding psychological topics associated with the aspect of disability. She's made many presentations through the American Psychological Association, Learning Disability Association of America, National Rehabilitation Association, and City University of New York. She's published many articles and book chapters regarding the subject matter, and she has served as a rehabilitation professional in her community and has become, again, very, very well known, and she is a board member and past president of Metro New York NRA Chapter 2001 to 2002, co-chairperson for exhibits of NERA Conference, and the typing's small, so I have to open it up a little bit. That was held in New York in 2003 and 2013. Sharon is a disability rights advocate and believes that access to one's environment is crucial, especially in the voting booths and the world of work. We sure have a lot to say about voting right now. We won't touch that, but that's certainly an area that does need to be looked at. Sharon, welcome. And Oscar, puede bajar a slide. Just say hello to the viewers before we start with the first slide, with the first show slide, and talk about what you'll be doing next week.
All right. Thank you, Dr. Aranda, for inviting me on your show. I'm honored to talk about people with disabilities. It's my passion. It's my purpose. I'm a person with a disability myself. I am totally blind. And next week, tomorrow is my last day at Berkeley College. And then next week, I'll start as the executive director for the Center for Independence of the Disabled of New York, Sydney. It is a social justice, disability rights, independent living center organization in New York City, and they advocate for equal access to all aspects of life for people with disabilities. That includes healthcare, employment, food, housing, transportation, essentially all the inalienable rights that people with disabilities deserve to experience like any other person without a disability. And unfortunately, at times, people with disabilities have difficulty in accessing services because of the barriers that are presented in the environment.
Yeah, and it's bad enough that there's all of these barriers and obstacles, but the pandemic certainly did not help. It created additional barriers in accessibility, and it required people to become more technologically skilled and able just to be able to maintain contact and communication with others. So that added another layer of an obstacle, of a wall for people. Also, doctors having virtual appointments or canceling appointments or having their offices shut down, then it was impossible to really have continuity of services in mental health or health. So we're going to get into some of these aspects, and I'm really delighted to have you here. We're going to start with the next slide just to get an idea of what some disability facts are, so that the viewers can have some sense of what's out there. As usual, I wanted to mention to the viewers that these slides cover a fair amount of information. It's hardly something that I will indicate covers everything. Nothing will. It's impossible to do an hour and 10 minute show and cover all aspects. But I think it's a fairly comprehensive amount of information to provide the viewers, and certainly those who are more interested and want to know further. We do have resources at the end of the show that you can turn to, and certainly we welcome and encourage the viewers to do some of their own research, some of their own educational surfing on the internet. Por favor, Oscar, slide 3.
Okay.
So here we have some disability facts, and you know, like I do want to indicate that Sharon was kind enough to provide really almost all of the data that I'm displaying today, so that we have, as you can see, about 61 million people. I mentioned that previously, who have a defined disability, and under the Americans with Disabilities Act, a disability is defined as an impairment that substantially limits the person in performing a major life activity. I've given you some data there. Approximately 19% of U.S. adults experienced mental illness. In 2018, that comes down to about 48 million, which is pretty large. I mean, it's a pretty large, substantial number. Really, we're looking at like 1 in 5 adults.
Right. And I would say, Roy, also, Dr. Roy, to let the viewers know that this is 2018 data. We know now, as of 2021, that the rate of mental illness just during the pandemic has greatly increased. Unfortunately, some of those individuals who experienced COVID-19 haven't sought treatment for their psychological needs. And I think as we go into 2022 and more comprehensive data is completed, that we will see that there will be an increase of the number of Americans that are dealing with mental health issues in the United States.
Okay, Oscar, put this up on the slide. I'm sure that a lot of it will relate as well to, I know that we were looking at depression as something very significant and generalized anxiety disorder, but I'm pretty sure that PTSD, has really, I'm guessing, skyrocketed with the pandemic, and I'm not sure how. I'm going to guess, correct me if I'm wrong, but I'm going to guess that the data are sort of like in a state of fluctuation right now because we're not over this pandemic. I mean, we hear a lot of what I'd like to say is sort of positive news, that we're getting there, we're controlling it. We've lifted a lot of the restrictions, and then though like 5 minutes after you hear this in the same news broadcast, you hear about the Delta variant, and I know that the last time the numbers came out, which was mid-June, the statistics indicated that 20% of people presenting with infections from COVID-19 was the new Delta variant. That's mid-June. I'm going to guess that it's probably getting closer to the 30% mark by now. And you still have...
I think that's a good estimation, yeah.
And you still have all of these people who, for any of a number of reasons, are not vaccinated. So this is a large portion of the population that is at risk for contamination with the Delta variant. So to be able to say that we're really getting to the end, I think is probably somewhat premature. I'd like to think that we have wonderful tools available to us, but that human behavior is probably the biggest obstacle to when we beat the beast, when we slay the beast, so to speak. But I don't think it's going to be, certainly not anytime too soon in 2021. But that's my opinion. Sharon, any comments on this before we go to...
Yes, I agree with you. I think it's good that you have this kind of show to kind of provide information to folks. Specifically, the pandemic has really, really hit minority populations, Black and brown people, Hispanics, Asian Americans, and so forth. And specifically in the Black and brown community, the vaccination rates are quite lower compared to the general population. And a lot of it is just not having the correct information about vaccines, especially the COVID vaccine, and how that really can protect the person from getting major infection or even dying. I understand the apprehension that some Black and brown people may have. The population has a lot of underlying health conditions. The population also can be comprised of people with disabilities, and because of their complex disability, maybe the vaccine is not readily available to them, or even because of maybe they can take the vaccine, but because of their complex disability, maybe they may not have access to it, they can't get to it, they don't have the transportation, paratransit is not running as well as it could run in their neighborhoods. Perhaps they're just scared of leaving their home because they know they're at risk. So it's really, really important for a lot of social service agencies that serve people with disabilities, especially Black and brown individuals, try to develop programs specifically geared towards that population, to give them the psychoeducation awareness of the vaccine, and also at times bring the vaccine to them, because they may not be able to readily get out there because of transportation difficulties.
Sharon, I think the statistics are only as useful as the context that you put behind them. Because if you consider, just as a hypothetical, that approximately, I'm sort of guesstimating that we are reaching the 60% mark of people in the United States having had at least one dose of the vaccine. I think that that's fairly accurate. I know that the hope was that it would be pushing 70% fairly soon, but I don't see that we're there, and I'm talking about fully vaccinated. But let's even use the statistic of 70% of people are vaccinated. That's only accurate if, like, you're considering that maybe in some parts of Long Island, 70% of people are close to that, or at least pushing the first vaccine. But if you're in a neighborhood, or you're in a state, or you're in an area that only 20% are vaccinated, then obviously that's flawed reasoning, because that becomes a very dangerous area. And if the people there are not really accurately informed, and perhaps they're thinking about, we're lightening up on restrictions, maybe we don't have to wear masks as much, or we can go places, they're going to get contaminated, and they're not aware of it, and then they're going to contaminate other people and so forth. So I think it's really part of the wonderful thing about the news is that it gives us all this information, but the downside is that it doesn't go far enough. We really need to be very, very careful about what areas we are in and focus on local news that's responsible, reliable local news, not based on, not Facebook, not social media. They're unreliable, not Twitter. Real, legitimate sources of news that are local and credible, and your local authorities and your local physician. I think those are the ones that are best, most competent to provide the information. So, Oscar, por favor, el siguiente slide. We're going to focus on people who present with mental health issues. El 4.
Yeah.
And some of these, the viewers will realize that these are some of these things we've talked about before. Some common psychological disorders, anxiety, panic disorders. I've left you some statistics there for you to see that we're looking at something fairly frequent. Close to 20% is pretty frequent. Generalized anxiety disorder, and I suspect that PTSD, like I said, has gotten much, much higher, especially with the pandemic. Substance abuse and addiction. I'm glad that Sharon, you really put some emphasis in that in terms of the number of people that are afflicted with some sort of a substance abuse disorder. Depression, very high. Bipolar disorder, which is a more biologically severe form of a depression. Eating disorders, more significant mental health problems like schizophrenia, borderline personality. And then you have the PTSD, although I think it's probably somewhat higher than that. Puedes sacar el slide, por favor, Oscar. Anything to add to this general overview of the types of psychological disorders that we see from slide 4?
Well, I think the biggest thing I want to convey to the viewers is that these type of psychological disorders do not discriminate. They affect all races and all ethnicities. And unfortunately, for those that are from minority backgrounds, they have a higher, especially Black and African Americans, Hispanics have a higher incidence of these mental health issues. And that's simply because of not getting treated. Not having good access to medical treatment, but more importantly, sometimes it's cultural, where psychological mental health or psychological well-being is not promoted as favorable among families compared to physical mental health, physical well-being or physical health. And I think people have to understand that psychiatric instability or non-wellness can lead to a slew of other physical ailments. It's almost like it's a reciprocal process. So for that population, it's really, really important to observe the warning signs of psychiatric illness and try to seek treatment, regardless of your financial status.
I think a positive side effect, if you will, of the unexpected effect of the pandemic is that it made issues pertaining to mental health much more salient and significant, so that we've had really much greater awareness and support at the level of politicians and people in power and people in authority, to make certain kinds of determinations and decisions and to render assistance. So that is really something, at least, that's been beneficial. And I'm hoping that as society develops this perhaps somewhat premature sense of security that we're reaching the end stage of COVID-19. Again, I don't think we're there. But as society, or at least large portions of society, seem to be believing this, I'm sort of hoping that we don't move into what I've seen so many times in the past, namely complacency.
Right.
After 9/11, everybody was all in favor of supporting cops and firefighters and rescuers, and we were all brothers and sisters regardless of our color, race, religion, under one roof. I mean, it was a moment that I felt so united, and it didn't last long. People, they just forgot about it, and they moved into complacency, and I hope that doesn't happen. I really do. And what more can I say? Scott, slide 5. Let's look at some of the common signs of distress. Again, these are some areas that we focused on this show in the past, so it's a little bit of a repeat, but I think it's important to do that. Repetition is good. So we have, feelings of numbness, disbelief, confusion, anxiety, fear. A lot of people with or without disabilities were experiencing this during the pandemic. Changes in appetite, energy level, activity, problems with focusing, concentration, difficulty sleeping, bad dreams, a lot of negative thoughts, physical reactions. We've talked about this: headaches, aches and pains, muscular tension, worsening of chronic health problems, problems controlling anger, increased irritability, short-tempered. We've seen increased use of substances, whether it be drugs, alcohol, tobacco, and substance use disorders. And Sharon, she emphasized the opioid epidemic. I gave you some statistics there. I won't repeat it. It's in the slide, but it is something that a little bit over 2 million Americans, they have an opioid use disorder. So again, that's not an insignificant amount. And, we're talking about people that we're aware of, people that it's reported. I'm sure that there's a lot that we don't know, or people that don't report it, or they hide it, or it's misrepresented, or lied about. Like a loved one won't necessarily say it. And especially in the midst of a pandemic, when people might be living with an abuser and they are afraid of speaking out against that abuser because potentially of domestic violence. So there's going to be instances where I'm guessing that these are really low estimates and that the real numbers are certainly higher, and we're not sure what they are, but they are higher. Puedes sacar el slide, por favor. Karen, Sharon, I'm sorry, anything to add to this?
I think the main thing, especially with the substance abuse, the drugs and alcohol usage, has been definitely, for some folks, a mechanism of coping during the pandemic. So even if you haven't start off with the label of being an abuser, you probably during the pandemic have definitely increased your usage, and you might approach that label and soon if you're not really careful about monitoring the use. So we do have our chronic users, but we also have potential new users who basically overuse during the pandemic.
So the issue becomes one of, not only frequency, but quantity, and I would also add probably the behavioral outcome of it. Because if the outcome is increased aggression or violence or indifference and failure to go to work, if you are working, or failure to tend to the kinds of activities of daily living that you normally were doing before the pandemic, then obviously it's very maladaptive. And by engaging in the maladaptive behavior, all you're doing is adding more problems to the mix. So at that point, you're going to have these so-called dual diagnoses that, like, we didn't get into, but you're going to have, possibly substance abuse disorder or substance use disorder on top of a depression, on top of an anxiety disorder, and so forth. So it's certainly something very sobering for us all to hear.
Time will tell, because the CARES Act funding for the unemployment is going to run out in a month or so. And the excuse that people have been using for employers having difficulty in getting workers is the fact that people are very comfortable with collecting their unemployment. And that may be correct, but I think we're going to see a little bit more than that, because once that payment stops, I mean, the idea is that people will start looking for work. But if someone has been chronically using substances throughout the pandemic and have developed a level of tolerance on it, you may start to see that those same individuals will not return back to work because they're, habitual users now. So time will tell us, to let us know what really the true severity of substance use is during this pandemic.
So Sharon, this seems to be something like returning to a early pandemic baseline when people did not have the resources, they didn't have the financial assistance, they were pretty much left to their own devices, and then some assistance came through, and because of that, perhaps some of them, it became easier and they just got into a more comfortable groove of living. Anticipating there's going to continue. So now if that's removed, it would seem to me that the behavior and the emotional part might go back to that baseline behavior. Am I correct with this thinking?
Yeah, but I also think it's two issues, because those that are using substances now as a coping mechanism that probably did not do that prior to the pandemic, we don't know, because maybe they had work as a big piece of their way of coping. Not everybody could survive working from home. People really needed that social interaction. They looked forward to work and their coworkers and having that experience. And a lot of people got depressed working from home and not having this social connection. So they took to using substances. Now when everything's open up and people have to go back to work, and that person as a worker who is now dependent may realize that he or she has a new label because they have a disorder or they have a dependency that they didn't have before, and they're going to have to deal with the treatment options and the whole change of life to cope with now being an addict.
And if not, then run the risk of increasing use.
Correct. Yes.
Okay. Oscar, por favor, el slide number 6.
Ready?
6. Okay. So we're looking now at people with underlying chronic medical conditions. I know that the public has certainly heard a lot about this in the news media. We focused a lot on people with asthma and COPD and different kinds of medical issues and disorders and cardiac problems. So here's a little bit of a summary in this one slide that certainly chronic lung disease, heart condition, asthma, weakened immune system, they're more likely to get severely ill from COVID-19. We've certainly recognized this and talked about it and focused on it since I think probably April-ish, May-ish of last year, more or less. I think we really became aware of this COVID-19 probably around March of 2020, so we're really 14 or so months into this pandemic. The authorities and some people were aware of it, doctors, earlier, going back more like to January or December of 2019. Adults with disabilities are 3 times more likely, think of that, 3 times more likely than adults without disabilities to have heart disease, diabetes, cancer, or stroke. Long-standing systemic health and social inequities have put various groups of people at increased risk of getting sick and dying from COVID-19. Including, again, this is something just to reiterate what Sharon was already talking about, people in ethnic and racial minority groups and people with disabilities. So, puedes sacar el slide. So, we covered a little bit of it in terms of the blacks and browns and people of different diversities. So, Sharon, anything to add to this?
No, I think it's clear, and it's unfortunate that when you have multiple identities, so you're a female, you're black, and you have a disability, we say you have the trifecta effect. Not in the sense that you're winning at the horse race, but you're actually losing because you're faced with more discrimination, more aspects of poverty, more aspects of underemployment or no employment. So it becomes really, really challenging for an individual who have multiple identities to try to find their way in a not such an equal and just society.
Yeah, well, I mean, this inequity, certainly, I've seen it so many times already, way before the pandemic. But, you'd think that employers and some other people and professionals would have become a little bit more sensitive to the needs of people that they are working with. But when I consider something like a professional tennis player, ranked number 1 or 2 in the world, withdrawing from a major tennis event because of an underlying emotional condition, and having the courage to come forward, and even under the threat of fines for not playing, still saying, and she's not the only one, and supporting. And I was delighted to see the outpouring of support that she got from men and women, males and female athletes. It was incredible. But the level of like disdain that was shown by the people, the promoters, the people who are looking at the loss of revenue and income and all of that, it just really, really rubbed me the wrong way. And I decided I want to do a TV show in the future focusing on athletes and the abuses that athletes have to incur. Those that are in training, you don't have to be professional. I'm talking about all kinds of athletics, and the effect of the pandemic on them, and being told you got to show up, even though look at what's happening with the Tokyo. There have been people already who flew in and they already tested positive for COVID, and they're still going forward with this.
Yeah. Well, I think in looking at the topic a little bit even more broader, there is a disparity between visible and hidden disabilities. And a lot of your psychiatric and your learning disabilities, your developmental disabilities, at times, those types of disabilities are quite hidden. And people just don't understand that depression and anxiety can hurt like a physical ailment. Also, I know we're going to get to it, but the stigma of disability is very, very strong. And it's important for us to understand that there is kind of prejudice among what disability types are accepted in our society and which ones are not. And that's very apparent when you have a psychiatric disability or a learning disability. I think we're going to see more of that, especially those individuals that had COVID and now were considered long haulers because they have a lot of memory and executive functioning difficulties, the brain fog, and now they're going to be coming back to work and having to figure out that whole negotiation process of accommodations due to memory loss or just being inattentive and not being the same person they were prior to COVID-19.
Yeah, the so-called sluggish brain, the neuro-COVID changes that have taken place that we're just really beginning to learn about them.
Yes.
This stuff is, likely to the side effects, the reactions. There's nothing that says they're going to go away the moment that you supposedly recover from COVID-19. I've seen people tell me that they're still having difficulty smelling, they're still having difficulty with memory, they refer to it as like sluggishness. Who knows how long this is going to happen? And a lot of the people that you were identifying, Sharon, they are the victims of microaggressions. I can't begin to tell you the number of times I've witnessed this, not only professionally, but as a civilian, like just outdoors, not in my capacity as psychologist, but I've seen the way people are patronized or looked down or frowned upon or laughed, ridiculed behind their back. And I remember one instance where this woman, in a previous building that I worked with, that I'm no longer there, but a building that had 2 elevators. And I remember going into the open elevator. The other elevator had not yet gotten to the first floor, and there was a woman in a wheelchair taking her time, struggling to get in, and I was there. And she went in face first so that she could back out of the elevator. And I remember there was I think one or 2 people that were in the elevator, and they sort of had a look on their face. But when the other elevator got there, they heard that the other elevator made the first floor. They jumped out and they took that other elevator. And that was so clear to me what that meant. And it was so painful. in my ride of 4 or 5 floors, I forgot how many floors I had to take, I engaged the person in a little bit of a conversation. When she had to get out, I made sure that I held the door open for her, and I wished her to have a nice day, and I recall she had a smile on her face as she left. And that made my day, that type of little intervention. Oscar, por favor, the next slide.
Sorry?
We're going to look at the, picking up a little bit more on this, which you were talking about, people with developmental and or intellectual disabilities. You were saying that some of the disabilities that are more obvious, more apparent, people are more stigmatized. This is just an indication that we have people with developmental and or intellectual disabilities who have underlying medical conditions. They may be at risk of serious illness. And people with developmental and or intellectual disabilities may have difficulties accessing information, understanding or practicing preventative measures, and communicating symptoms of their illness. Puede sacar el slide. So this is a little bit in keeping with what you were saying in terms of the stigma and the microaggressions and the visibility and the perception.
Yes, because if someone has, intellectual disability, they may not understand the importance of wearing the mask all the time, and especially in the early pandemic where it was so critical, they may be treated poorly for that. And it's really a comprehension thing rather than non-compliance.
They might get yelled at.
Well, I was trying to say it nicely.
If they go to a store, they might get yelled at if they go to a store.
Yes, they'll get yelled at or put down or, maybe cursed at, if it's in a public place.
Yeah. Just in the news, I don't know if you picked up on it, but there was this 15-year-old autistic male adolescent who, from Long Island, Wednesday had taken his bicycle to a store. I don't know if like a food and eatery or something, and from there, apparently he met a 20-year-old male, and they left, and the 20-year-old male literally kidnapped him. That's what came out in the news. Oh, wow. And he ended up in another state. I forget which state, but he did end up in another state, and the police were able to track it. But the boy with the autism was obviously successful enough to be able to verbalize and to be able to ride a bicycle and independently on his own go to a store. And they did find him. He is recovered. He's back with parents, and I guess the police is still under investigation. But long story short, you have some of these people with intellectual disabilities or even psychiatric disabilities that it might not be apparent or obvious, and it puts them at a potential for being at great risk, as was this case right here. And I'm certainly going to follow the outcome of this because I'm from Long Island, so I do want to know what the outcome is. And by the way, I do have an interest because of one of my sons who has special needs. So it's certainly something that is a great interest to me. Por favor, Oscar.
Ocho.
El ocho. This slide pertains to older adults and those in long-term care. So older, unvaccinated adults are more likely to be hospitalized or die from COVID-19. We saw this, of course, at the very beginning of the pandemic, where it was incredible, and the concerns and the worries, and even why when the vaccine came around, it was like a phase level of being eligible to receive the vaccine, and it was going to your elderly and people with chronic high-risk medical conditions. The recommendation, and you've heard it from me many times, is to get vaccinated as soon as possible, if medically recommended. My advice is always, I'm certainly in favor of the vaccine. I follow the news, I follow the science, I've listened to enough professionals, and I've read enough in the professional literature to know that the science is solidly there. Plus, the vaccine wasn't just invented a few weeks ago. These are things that have been in the making for decades. Researchers for decades work on vaccines, and then depending on what's out there, they make adjustments or modifications. And of course, they get people to serve as experimental controls and subjects to see what the effects are. And they do this scientifically. They've been doing this for a long time. So the makings of this particular vaccine, has been there for years. And they finally hit on the right formulas and so forth to come up with the Pfizer and the Moderna and Johnson & Johnson and others that are along the way. So I've certainly, with my population of patients, I haven't seen anyone, not one of my patients, reported a really horrible adverse effect. The most I've gotten was a little bit of pain in the arm, some discomfort, feeling tired, and typically the longest lasting was 3 days. Usually it was over like in a day or two. When I was vaccinated, I didn't even stop working with my patients. I continued to work with my patients. For me, it was great not to feel the pain, not to feel tired. Being busy was an antidote to whatever the side effects were. But I'm not a medical doctor, and I'm certainly not your doctor, so any doubts at all, by all means, talk to your medical doctor. Your medical doctor knows your history, knows your record, knows whether or not you're eligible and so forth. If you've had COVID-19, it probably takes about 3 months after you recover from it to be eligible to get the vaccine. So do, by all means, consult with your doctor. Older adults and those who live with, visit, or provide care for them need to take preventive measures to protect themselves from getting COVID-19. Sharon, I'm amazed when I hear that there are people, my patients, telling me that they have like home health care, and that the home health care worker is not vaccinated, comes with a mask, wears a mask at the home where they're providing the care of my patient, and then they go home to their family that's not vaccinated. And one, in fact, told me they just had a baby that's about 2 months old, and they're not vaccinated. It's like I'm stunned when I hear these kinds of things.
I think you should also look at. I think you should also look at who's working in those industries. There's a lot of minority folks who are working as frontline workers in home health care. The salaries are really atrocious of what they're making, and there's a lot of fear of the vaccine because, again, not having access to the right information to know about vaccine. They're given the offer of taking the vaccines through their home health agencies, but are refusing. A lot of companies are deciding not to mandate vaccination among their employees because of lawsuits. I mean, there's certain, like I know the Houston, a big Methodist, Houston Methodist Hospital just had this huge lawsuit where they did win because they wanted to mandate all of their staff that are working with patients to be vaccinated, and some of the people did not want to be. I'm not surprised by what you just said. I think, again, you have to look at who's filling those positions, what the employment and how much they're making, what their knowledge base is, where they're living. Are they living in those neighborhoods that have the 10 to 20% of vaccination? It's scary, but this is why you have your show, and we're trying to let people know, those from minority backgrounds, that they are putting themselves at risk and they need to get more information. When you say go to your doctor, for some of these individuals, they don't have a general practitioner. They don't have a relationship with that one-on-one doctor as from like individuals who are more privileged and have access to healthcare. when you don't have access to health care, you don't go see your physician every year. You go to a clinic, and you only go into a clinic when you're sick because you don't want to miss work because you need to make the money, and you don't want to pay the bills. So there's a lot of disparity with healthcare, and we have to understand where these people are coming from.
Okay, well said.
Sorry, I went on a tangent. Sorry.
No, but do the best you can. If you don't have a healthcare worker, try to speak to significant other, friends, other people who have had it. Do whatever you can to really examine the necessary type of information you need in order to get informed. I think that's probably the best thing that I can say. The recommendation, by and large, really is that the vaccine saves lives and COVID-19 takes lives.
Right.
So
that's why they launched, especially in the minority neighborhoods, mobile health units to go out to the churches, to the community centers, to reach out, to the bus stops, to reach out to Black and brown people to let them know about the vaccine, hand out flyers, give information, because they're not necessarily going to the clinic. So you need to go where they are.
Okay. Let's look at some interventions now on slide 9. I'm just going to gloss over some of the major ones. Continue with your routine care, whatever routine care that was prior to the pandemic. Try not to interrupt that. Now that it's certainly become safer, to go to see your doctor or to a healthcare clinic, and you don't have to worry so much about getting sick on the way, going there or being exposed to COVID-19. Try to maintain routine care, continue with your medications, with your treatment plan. For those of you who have a provider and so forth, discuss concerns that you may have about your treatment. Make sure that you're obtaining whatever tests, whatever procedures the doctor recommends. Continue with your routine immunizations. Here in Long Island now, they're focusing on Lyme disease and people getting vaccinated. So that's something I just heard a big drive just yesterday in Suffolk for Lyme. Make sure, for those of you who have needs, you have medication needs, make sure that you have your supply. And if you run out of it, that you have some sort of a mechanism or a plan, plan A, plan B, whatever it takes in order to make sure that you can get the medications that you need. You don't want to have the situation that happened couple of years ago when the economy was shut down in the United States, and you had people that required certain kinds of medication with diabetes, and they had to sit there and take half doses and things like that, and then some people actually did not survive because of that. They didn't have the medication that they need. They were not in a situation of being able to plan for it. So you need to be able to prepare a plan for any potential emergency as it comes up, and really think it through and have some sort of a mechanism available. Oscar, ¿puedes sacar el slide? Okay. Sharon, anything to add? We're gonna focus on some treatment options.
Yeah, I think you covered it.
Okay. Oscar 10.
Enter passcode.
These are some treatment options. Again, on this show, we've focused on this many times before. Some people may need to take psychiatric medication, so make sure that you continue with this. Again, we talked about prescriptions. It doesn't just have to be psychiatric medication. It can be medication for pain, medication for medical disorders, medication. Stay on top of it. Individual, group, family therapy, day treatment or partial hospitalization kinds of treatment for some people. Specific therapies, we've focused on that: behavioral therapy, cognitive behavior therapy, dynamic kinds of therapy. Meditation, we have focused on this a lot before. Biofeedback, hypnosis, relaxation therapy. There are many of these exercises. The simplest one is like a deep breathing exercise. You have computer apps aimed at well-being, like the Happy 5 app. You also have Calm. There's many stuff on the computer that you can get that gives you breathing relaxation exercises, music. You can pull up exercise that we've done on one of my TV shows as well on relaxation. There's plenty of things that are out there. Creative therapy, music. If you enjoy music, art, drama, video. The nice thing about this, I didn't mention this in the slide, but the nice thing about these creative therapies like music, art, drama is that it feeds the brain. I mean, this is wonderful for the brain functioning, music, dancing, all of these stimulate cognitive functioning. So it's great brain. It's natural brain feeding kinds of activities that help your brain. As well as your body, obviously. If you're moving and you're doing things, it will help your body. Lifestyle adjustments, seek peer support. You can do that even on the internet through Zoom if you don't go out. Self-help groups, again, also through Zoom, books, supported housing, dietary supplements. So there's a lot of things that you can do. Exercise, we have focused many times on trying to increase your level of movement. Whatever it is that you're able to do, try to do it and try to add a little bit slowly at a time within your means so that you don't injure yourself and you don't go overboard. A little bit is better than nothing. Too much, you can hurt yourself. So you need to start with whatever you're able to do and work your way up. Of course, gainful employment, we focused on that. Working, it makes you feel, not only do you get an income, but you feel you're doing something valuable and useful for your family, for society. It's a wonderful feeling. Psychosocial rehabilitation, community programs, and I already mentioned the computer acts. Put this on a slide. Anything to add to that?
I think just a couple things. I would say for individuals who've had COVID and who are experiencing the long hauler effects, a lot of these things, like we said, is good brain activity, but also because they may have attention issues or organizational or focusing or memory difficulties, learning something new, like playing Sudoku or puzzles or even learning a language, learning how to dance, doing a different dance routine that you never did before. I think getting some of those neural pathways to do things that you haven't done in the past can really, really help you in trying to deal with the after effects of COVID-19.
The message is to do something. To do something that's available, accessible to you, and not to give up and not to just languish doing nothing, but to do something. A little bit is better than nothing, and try to gear it and do it according to your physical, emotional kinds of needs. And if it's for children, you have to consider their chronological ages and make it so that it's appropriate to their age group. Sharon, the next slide is really something that's more focused from your perspective as an educator. So, el número 11, which is really academic interventions. 11?
You want me to go over this? So I wanted to help faculty and students that are attending higher education that have disabilities, because the pandemic, for a lot of our students, especially our students that had autism or executive functioning difficulties, taking courses online has been really challenging for them. And we needed to really develop a universal design and instruction that really focus on the auditory as well as the visual stimulation for all the students. students involved, and having an understanding that, imagine if the faculty member sits in the shoes of a student with a disability. If they had to learn differently, what kind of instructional aids they can use in their courses, especially now their courses are being taught through Zoom, that can still stimulate the student and still help them in acquiring the knowledge. Because a lot of our students want to be on campus because they like that face-to-face, they like that one-on-one instruction. So universal design, essentially, it's incorporating all your senses in instruction. So it's not just speaking. It's really using any visual aids, any auditory aids, any tactile aids in the classroom, any sensory, virtual, artificial intelligence, a virtual reality kind of instruction. It's helpful. The type of language that you use when you're speaking. Sometimes when we teach, we'd say, look at this, and if you see here, and if you have a student that is have a visual issue, or maybe they have auditory visual processing or migraines, and they can't really focus on looking at a screen, those descriptive words, look here, that's not really helpful. So maybe for the faculty member, just describe what you're saying rather than say, look here, look there. Be aware of microaggressions. A faculty member really has a lot of power within the classroom or the virtual classroom. So things that you may not understand in the sense of what the person with a disability is experiencing, how they learn. Don't assume that they have resources that you may have, because they may not. They may not be really available to assist technology, having a computer. Maybe they only have a cell phone that they can use for classes. So you have to figure out how do you go about making sure that they have access to the same quality materials in the class if they don't have a laptop or a desktop.
So no, go ahead, Sharon. I didn't mean to interrupt.
And one of the biggest ones, we have a lot of students with post-traumatic stress, and that could be due to their military service or domestic violence or trauma or even some type of injury. The type of videos, movies, clips that you show during your online session can also be a trigger if it has a certain type of violence in it, if it has gunfire, that kind of sense and heightened information in those video clips. So when you're working with students in your college campus, you do get an ADA plan from the disability office for all the students in your class. The first thing I would recommend is to read them and be aware of the students in your class and what their needs are. A lot of the disability-specific requirements for the ADA plan is on that plan for that student. So you will know if a student in your class, it can be triggered by a movie. We won't tell you that they have post-traumatic stress because by law we can't disclose the disability type, but we will tell you that be mindful of these are the accommodations, meaning they're unable to watch a certain movie with violence or something like that. So you will be told that particular disability specific accommodation. And the last thing is that every college campus has disability and counseling services available to the students. That's built into their tuition. So know the resources on your campus. Know where to refer your students, especially if they have COVID-19. That's considered a temporary disability for most colleges and universities across the country. So if your student is succumbed to that ailment, you should refer them to the disability office to get accommodations.
Okay. So Sharon, for the viewers who have children with some sort of a disability in school, or they themselves are attending some sort of a schooling or vocational program, even as adults, the message would be that wherever it is that they go, somehow these kinds of some issues, some of these programs should be accessible, available to them just as they would be for other, say, able-bodied or people without the disability. And if there's some issue, are they supposed to talk to somebody about it, or talk to the principal, or what should they do if they are concerned that somehow they're really being ridiculed or bullied, or that they're not being looked at properly?
Right. So the law is different from K to 12 versus higher ed. So I'm going to answer the question in two parts. Let's start with K to 12. For K to 12, every child is mandated by IDEA, which is the Individualized Disability Educational Act for students with disabilities from K to 12. Every child, it has to be tested to make sure that he or she is on grade level, and if they're not, they'll receive either a 504 plan, or they'll receive an IEP plan that will give them the specialized educational services that will help them in their education. So from K to 12, it's a mandate where the school district is responsible to ensure the related services for students with disabilities. If a child is being bullied and they're a student with a disability, that is something that could be discussed during your IEP, annual review, and also during, if it's really, a daily issue, meetings with the principal and the superintendent should be done, and also your school social worker to ensure that the child is safe. Now, in higher education, it's entirely different. Under the Section 504 of the Rehabilitation Act, it says that the college is responsible to provide reasonable accommodations for students that are a qualified student. However, the student has to self-identify to the college to ask for these related accommodations. So for every student with a disability coming into any college campus across the country and also its territories, you must go to the disability office and provide medical or psychological documentation documenting your disability and what accommodations are needed. The disability office is not going to look for you. You have to look for them. Most disability offices do a lot of new student orientations. They do a lot of promotion. They have websites. They do flyers. They really try to get the word out. But again, in looking at the utilization, there's right now about 15% of the U.S. population in higher ed have a documented disability. So it's very significant if you look at the entire higher ed population. However, not all those students are getting served. And unfortunately, within the first year, about 40% of students drop out, regardless of disability status. So it's really, really important, if you have a disability, to self-identify with the office, provide your documentation so that you can be served.
Okay, thank you. We have only a few minutes left. We have to go through the employment interventions. We'll try to make that a little bit quick so we can get into the resources. So, Oscar, por favor, 12. This slide focuses on employment interventions. I'll gloss over it a little bit. Create a work environment that's inclusive to all individuals of all diversities, including hiring of qualified individuals with these kinds of diversities. Provide routine work-related training to all employees that include aspects of diversity. So it's like a sensitivity type of a training and exposure to different kinds of diversities. And things like, microaggressions, I guess, would fall into that kind of training, along with other aspects. Monitor word usage and memos, reports, videos, displays, etc. Furniture, equipment, sometimes like a wheelchair needs room to fit into a table, so you have to have ergonomic kinds of settings in the classroom that accommodate the needs of the individual. Use of relaxation rooms or stress-reducing employee space that's away from the employee's typical workstation. Provide a work environment that includes supportive demonstration of one's cultural background including things like religious objects, hairstyles, selection of clothing, use of language, etc. And the overall message here is that overall psychological health is as important as physical health. Boy, this I got a slide. Anything to add to that?
I think that's good. I think the main thing to say is that work salience is important for everyone, regardless of your disability status, and never assume that the person with a disability do not want to work. A lot of the times they do, but they have barriers to employment because of stigma and prejudice. So if you have a work environment that promotes disability awareness, or you're quote-unquote disability friendly, you need to promote that and get that out in social media, the community, so that people with disabilities will say, oh yeah, I want to go work for that company because I know that they really understand me. I mean, Google did this as well as Apple with their autism program, where they specialize in doing a computer graphics and graphic design specifically for individuals that had autism, because they had that creative side, and they've been promoting their programs just for that population. So it's important to know those programs do exist.
I plan, Sharon, to do a show on dealing with employees and how they are treated by their employers, and to what extent the employers really provide for their mental health and emotional kinds of needs. And just very briefly, because Oscar's beginning to give me this nonverbal communication that we're wrapping up soon. But very quickly, I went to one of my routine 15-minute medical appointments at my healthcare facility, which really boils down to 7 minutes, because by the time you check in and they ask you the 4 questions about whether or not you have thoughts of hurting yourself, and they take your blood pressure and a couple of other things, you have 7 minutes with the doctor. But in waiting for the appointment, I actually went into a waiting area that I couldn't even see the woman who called me to go in, because it was dark, and she literally had to get out of her chair to look through a window so that I could see her. And then I went into the area where she was. This was the reception desk before my going to see the doctor. And she was like sitting at a chair with a computer glued, bolted to her desk. So that's what she couldn't see. And it was dark, and I said to her, why don't you put some pictures up? It's got to be very claustrophobic where you are. Why don't you put some pictures up? She says, we're not allowed to. I said, but if you had like pictures that would open up your room, it would make you feel a lot happier. You'd have some sunlight in here. Nope. She liked what I had to say, and she was happy about it, but she was literally in the dark in a room with no windows, no nothing, and no contact with anybody except for the patients, and just to take their information, give them their appointments. That's got to be a formula for burnout, as far as I'm concerned. Por favor, we're going to look at the last slide, which is the resources, and you can see that I have my name and my consultant, Dr. Canaris, as well. And Sharon, I put you prominently right underneath that with your contact information, phone, and the website of CIDNY. I have that website there for the viewers. Also, I posted a link that you provided for me regarding this was the project evaluation site list link that you gave. So these are some, I guess, resources for the viewers. Beneath that, we have New York State Psychological Association, which is the main association for psychologists in New York. APA, the parent company for all of the states and provinces. I gave you the contact information. And my local regional psychological association, which is Suffolk County. So I think that puede sacar a slide. So that said, Sharon, any parting message or words that you want to give the viewers as we wrap up now?
Yeah, so for people with disabilities, I encourage you to seek the resources that you need. There's a lot of resources available. It's just a matter of finding out where they are. If you're in New York City, you can definitely look at Sydney.org, CIDNY.org. Also, if you are a long hauler and you're have this new diagnosis and not really sure if you are eligible for accommodations, I would tell you that you should definitely seek evaluation to find out if you are. Access VR is a state vocational rehabilitation services that serves people with disabilities. It's a federal program. It's in every state. We have that in New York. For physical disability, you can go to Access VR. If you're blind or legally blind, you can go to the New York State Commission for the Blind, and they'll give you vocational rehabilitation services, because some COVID survivors have been affected with their vision as well, and leading into legal blindness. So it's important to know that COVID can affect your eyes as well.
And it can affect the speech also. I had a patient that ended up, she couldn't talk. It got to her vocal cords. Oscar, ¿alguna cosita?
Que tengan una feliz noche.
Oscar is saying have a wonderful night. To all viewers, I wanted to thank you for your joining us, and I hope that you're safe, and especially safe around the extended July 4th holiday. Please, there's going to be a lot of people out. It's a heavily traveled day. Please make sure you're safe. Be careful. Don't expose yourself to unnecessary risks. Plan your outings. We've got a lot of inclement weather, a lot of people out there, and unfortunately, some people are going to be partying and drinking excessively, so really be careful. Be careful with your neighbors. Certainly for the viewers, I encourage you to be sensitive to the needs of these populations. And if you yourself have some sort of disability, then, I hope the best for you, and that the show had some informative value and use for you. To everybody, stay safe. Oscar, gracias for putting up with me this long. Sharon, thank you so much for being a wonderful, very informative guest. I certainly learned several things. I'm going to have to review it myself. To all the viewers, the show's being recorded. Feel free to look at it as many times as you like and take screenshots of the slides. So that said, I will see you next week. We have a show on immigration, an update on immigration, and I will have an attorney, Adam Tavares, as my guest. That's on July 8th. So that said, good night, everybody. Buenas noches, Oscar. Good night, and thank you, Sharon.
Thank you so much.